Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I am a consultant neurologist now in Kolkata.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, so first thing we should know that everything in our body is controlled by our brain, and everything that our brain does, like communicating a message, any action or emotion, it is all done by some electrical currents generated by chemical reactions. So everything is done through these electrical impulses. When these electrical impulses in the brain gets defective, and this defective electrical impulse spreads to the whole brain in a very short amount of time, there it is called seizure. This is the background of seizure, and what we can see in the patient is abnormal
Radha.
posturing of the legs or arms. Patient can be unconscious. Patient can have violent, involuntary, jerky movements. So this we can see, and the background is defective electrical impulse generated from the brain.
What is epilepsy?
So epilepsy is a medical disorder which is characterized by seizures, जिसमें बार बार ऐसे सीजर एपिसोड्स हमें दिखते हैं. So to define a patient of epilepsy, he or she must have at least two unprovoked seizures. ताकि हमें कोई प्रोवोक्ड फैक्टर के बिना हमें सीजर अगर दो या उससे ज़्यादा मिलते हैं पेशेंट्स को, तो हम उनको एपिलेप्टिक पेशेंट्स डिफाइन कर सकते हैं.
What are the different types of seizures and do they affect people differently?
Yes, there are various types of seizures. The most common ones I'd like to tell. The most common is the generalized seizure. Generalized means it affects the whole body. That means the patient has this involuntary jerky movements involving the whole body. That is the generalized seizure and the most common type that we encounter. Second, there can be a focal or partial seizure where a specific part of the body, like any specific leg or arm or the face, can be affected. It can have involuntary jerky movements. Or there is another seizure called the absence seizure, where there is no uh, jerky movements are witnessed, but there is a patient has a blank, vacant, staring look with a period of unresponsiveness. So that is called absence seizure. So different kind of seizures are there, and they look differently. So every seizure we have to pick up and treat accordingly. So identifying seizures, various kinds of seizure, is very important for the treatment.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So there are various causes for epilepsy, but unfortunately, almost half of the epileptic patients do not have a defined cause. But that doesn't stop us from treating the patients. So as this epilepsy can affect any age group of the patients, from the newborn babies to the elderly population also. So according to the age, the causes of epilepsy are different. In the newborn or in the childhood, the most common cause of epilepsy is brain infection, any developmental brain damage, or any genetic cause. In a later period, like in adolescence or young adults, mostly it is caused due to any genetic defects. In the elderly population or middle-aged or elderly population, the most common cause of epilepsy is something structural, like there can be a tumor in the brain, there can be a stroke that is leading to epilepsy. There can be some neurodegenerative disorders like Alzheimer's or other neurodegenerative diseases that can cause epilepsy in elderly patients. So according to the age, the causes of epilepsies are different, and we are still finding for the all the causes, but still At this moment, almost half of the epileptic patient do not have a definite cause behind their epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes, that is a very important question because caregivers must understand how a epileptic patient looks, what is how a seizure episode looks like, so that they can identify that seizure immediately and seek medical help to prevent those things. So, what we mostly occur in seizure episodes, like before the actual seizure appears, there can be a period of abnormal behavior or some anxiety or fear without any specific cause. The patient can say something like, "I am anxious, I am fearful," but he or she could not provide a specific cause for that. After that, mostly a seizure episode starts with abnormal position of the eyeballs. It can be deviated to one specific side, or it can go, and there can be uprolling of the eyeballs. After that, mostly we see that there is a space, the neck is turned to a specific side, either it is on the left side or the right side, and there is abnormal posturing of the arms or legs, leading to abnormal jerky movements of the all the four limbs. So the whole duration of this seizure generally lasts for around 1 to 2 minutes. After that, it subsidized on its own in most of the cases. In some cases, some rare cases, it can last more than 5 minutes also. So that is how a generalized seizure looks. In cases of focal or partial seizure that I specifically mentioned, whole of the body may not have a abnormal posture or the jerky movement. Only a specific arm or leg can have this abnormal posture or movements. And in case of absence seizure, as I previously mentioned, it can there can be no movement at all, but the patient will be having a blank and vacant staring look with unresponsiveness. He or she will not be able to respond to the conversation with the relatives or the caregivers. So in all these situations, the relatives or the caregivers should identify that the patient might be having a seizure episode, and he or she should be treated for that to prevent further seizure episodes.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, that is a deep-rooted social problem we definitely encounter in epileptic patients because, as I previously mentioned, how a seizure looks, it is definitely a scary thing to see for a layman. Person suddenly becoming unconscious, suddenly his arms and legs are in abnormal postures. There is a violent shaking movement occurring all over the body. Sometimes there is frothing from the mouth. All these things is a bit scary for a normal people. And from early ages, the seizure episodes have been, there are many myths regarding the seizure. Some tell that there is some paranormal activity involved, something there are ghosts involved, something the patients are told to be cursed by someone. So, but after the development of modern medicine, we now understand the background behind these problems, and now it is we treat these patients day in and day out. So many of the time we see that epileptic patients are stigmatized because the deep rooted cultural beliefs that we have from our past.
How does this stigma affect people with epilepsy?
uh, this stigma, as it is very prevalent in our society, and as we are talking, we are trying to raise the awareness about these seizure episodes and epilepsy so that the stigma goes away. The stigma poses a problem for the patients at different ages differently. Like in children who have epilepsy, many of the times we see that they are not able to make friends in schools or playgrounds. Other parents tell their kids to not to play with epileptic kids. They fear that it can be contagious. Their kids can get this disease if they are mingling with them, playing with them. So that is definitely a problem for a child with epilepsy to make friends and do activities with them. In cases of women, we see there is a very deep rooted tendency to hide the diagnosis of epilepsy before the marriage and get the wedding done. After that, they have these seizure episodes and they again start medication, or there is some problem in the married life. So these all things come differently. In elderly age group also, after this seizure, there is if the seizure is occurring in first time in the elderly age group also, they are sometimes not treated properly. They are just given some alternative medicine. So these are problems we face day in and day out.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. So there are some very specific triggers that can cause seizure episodes in epileptic patients. The most common trigger that we see is lack of adequate sleep. So every time we see a epilepsy patient, we advise to have at least 6 to 8 hours of sound sleep every day. uh, Most of the time we see when there is a function in the house or the patient is having a overnight journey, their sleep is disturbed, and the very next day, even if they are taking their medications regularly, they can have a seizure episodes. So the lack of sleep is very prominent trigger. Same thing goes to increased stress. It can be physical stress, it can be mental stress. Both of these can cause propensity to have seizure in an epileptic patient, even if the patient is on medication. In cases of infection that is causing high fever, raised body temperature like more than 101, 102 degree Fahrenheit, it uh, rises the chance to get a seizure to quite a few folds. Okay. Another thing that is very important nowadays, that is flashing light or strobe lights that we see in pubs or in DJ parties. So always tell the epileptic patient to avoid these flashing lights, as this can induce seizure. Another thing, in women, sometimes the hormonal changes during a menstrual period or in pregnancy or post pregnancy period, sometimes it can cause a propensity to increase seizure, but that is not very common that we encounter.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Okay. So, why we must understand why there is injury during a seizure, because when a seizure episode starts, the patient is not conscious. Okay, the patient generally falls, and after falling, also there is a violent jerky movements, sometimes involving some of the limbs or sometimes the whole body. So, with this, there is chance of getting injured is very high. There are external injuries, there can be internal injuries like tongue bite, or inside teeth can come out, fall out during the season. So what can we do to minimize these injuries in a epileptic patient? So first thing, in the home of the patients, we tend to advise that it should not be a hard floor. uh, and there should be carpet on the floor, because after the fall it can absorb some blow, and the sharp corners of the furniture should be padded. The patient should not be allowed to come near any open fire like a stove. They are encouraged to use a induction cooktop or microwave to minimize the fire or burn injuries if they have a seizure in the kitchen. Same thing goes for the water also. We don't tell the patient to have accumulated water, because if the patient gets unconscious, a small amount of water can cause a big hazard to the problem to the patient. So these safety tips we generally give, and in other countries, some of the patients in our country also, we can use a bracelet with their name and identifying that they are epileptic patient and an emergency contact number. Because if the patient is having a seizure episode in public place like in a street or in a park,
Right.
so that the nearby people can contact the emergency contact person immediately and take the patient to the hospital. So that can be a good safety measure.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Yes, one final thing that I want to say to the patient and the caregivers: the most common cause of relapse or a breakthrough seizure that we see in epilepsy patients, that they tend to miss some doses of the medication. So that like that the patient is taking the medication for say 2 to 3 months, and he or she is fine. He didn't have a single episode of seizure, and then he decides कि चलो 2 दिन बाद से फिर से स्टार्ट करेंगे, 2 दिन नहीं खाएंगे तो क्या दिक्कत होगा. So these things happen कि if a single dose is missed, there increases the chances of getting a seizure. And every seizure, however minute that may be, it damages the brain. In the long run, these small seizures accumulate the brain damage and ultimately can lead to some problem in future. So do not miss your anti-seizure medications until a doctor tells you to do that. Please take the medicines on time, and don't the spread the awareness about the epilepsy and seizures. And if you know any close one, any relative, any friend who is having epilepsy, please tell them to seek proper medical care. Even though we do not know the proper cause behind epilepsy every time, there are a lot of treatment options like medications, like surgeries, that can lead a patient seizure free and to live a happy and fulfilling life.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.